County Board of Supervisors for Monday, October 19th, 2020 into order and have roll call public notification.
Okay, Bill Efforts.
Yes.
Bert Skinner.
Here.
Dale Heineke.
Here.
Bob Rogers.
Here.
Oscar Scott.
Here.
John Banks.
Here.
Terry Lee.
Here.
Carolyn Bartlett.
Here.
Pam Paul. Here. Bill Stradle.
Here.
Gary Taxtall. Gary Taxtall let us know he wouldn't be here. Jim Gores.
Present.
Gary Nelson.
Here.
Roberta Mosentein. Here. Pete Olson.
Here.
Steve Johnson.
Here.
Carol Moen. Here. Eric Panier.
He let us know he wouldn't be here.
Okay. Louis Oki.
Here.
Russ Ramsey.
Here.
Todd Gurlin.
Here.
Jerry McRoberts.
Here.
Barb Thompson.
Present.
Bun Hansen.
He let us know he wouldn't be here too.
Okay. Stacy Wenzel. Here. Dana Heller.
Here.
Bob Anderson.
Here.
Dan Buchanan.
Here.
Don Horstman. Okay, so at this time, we have got 25, oh, I can't do that.
Yeah, it is. 25 present.
4 absent, 25 present, 4 absent. IDA Cook County Clerk have complied with the open meeting public notification laws. Meeting notices are posted on the electronic meeting notice board and the first and second floor of the government center and the main floor of the justice center. Hard copies in the public meeting folder just inside the clerk's office window. In addition, all 5 county newspapers have been notified.
Thank you. And we have Deacon Linton from St. Anthony's in Cumberland.
Begin in the name of the Father, and the Son, and the Holy Spirit. Amen. Heavenly Father, we thank you for the gift of this day. We thank you for the gift of your Son, Jesus, and all that he means to us, and for his continued presence in our life. We thank you, Lord, for the peace that you give us, even in times of difficulty. May you always be strong in our minds and in our hearts, and walk with us as we go through each and every day. We thank you, Lord, for the gift of your servants who are gathered here to provide for the services and needs of this county. May they always recognize that they are part of something bigger than themselves, and that the work they do here is profound and important and necessary to the safety of our communities. We thank you for the gift of them and for their willingness to serve. We pray this night, especially, Lord, for families. We ask that you watch over them, that you keep them safe. Help fathers to always be slow to anger, mothers filled with kindness and compassion, and for children to be obedient always. We thank you, Lord, so much for all of the gifts you give us. And we thank you for your love and for this life. We ask this in the name of the Father, the Son, and the Holy Spirit. Amen.
Amen. Thank you. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, item number 3 under special matters and announcements.
Okay, hopefully you can hear me. I want the county board to know what a successful blood drive we had. Thank you, Jess and others and staff. And when we combine that with what Mosaic did, I believe it's over nearly 60 pints of blood. So we've done a great work here in Barren County between Mosaic, and I thank them and for the Barren County employees and everyone that gave blood here. Second, the executive committee meeting will be meeting next Monday. So those are an executive, please mark it down. Next Monday morning, 7:30 a.m. 7:30 because we have the highway siting committee at 9 o'clock. So if you could please write that down. And on that will be the financing resolution for financing the county in 2021. Finally, I'm going to ask Louis or one of the board members to please pull items number 7 and 8. I'd like to read a statement. We didn't get qualified bids, so I will read this statement. Sean, I will inform the board on Monday night that we did not receive any qualified responses and that you will be meeting with the executive committee on 10/26 to address next steps. And that at this time, you are planning to address the board at the November 2nd meeting, and that if a second meeting is necessary, that would occur on November 10th. We didn't receive any qualified bids from the banks, so we'll have to look at going to open market or to go with a negotiated sale. And that's what he will be talking to the executive committee so they can make a recommendation to the county board at the November 2nd meeting, or if we have to meet on November 10th to get that going. So those are the two matters affecting this. Thank you.
Okay, under public comment, we have our esteemed Sheriff, Chris Fitzgerald, would like to speak to us.
It's on.
It's on. Oh,
It's on.
it's
It's
on.
on.
There. Yeah, I'm talking to Jeff, and I think it's important that I believe you have at your spot our press release from this afternoon. But I would like to address several issues in regards to the happenings over the past week. One, victims are still being served, and number two, the most important issue is the hate stops now. First, I want to thank everyone who gave their input on this issue, all of the citizens. I'm fairly confident I've responded to every note that was sent to me. I learned a lot from some people. We have to grow to move forward. And I also learned there's a lot of hate and anger out there without knowing all the facts. I will note that I'm somewhat disappointed in some of our media. Local media is not included in that, for trying to push this as a race issue when this is not. Here are the points we are working on. First, no victim services have been lost, and Embrace is still serving any and all victims in Barren County. How this continues is under discussion when the DHS Director Frolic returns, and because this falls under her department. There are more issues on this topic, including county policy issues that will be discussed. Second, this has nothing to do with race. While vigorous debate is healthy in America, I feel and have felt we have taken a turn towards unhealthy dialogue in this country. Too often we set out with the intention of proving another person wrong, rather than seeking to understand why we feel a certain way. The Sheriff's Department stands with everyone on unjust social, racial, equality, and justice issues, and will take on those issues with anyone within our scope to make sure everyone is treated the same, including any law enforcement officer with proven claims of unnecessary force. It will not be tolerated. I and other members of leaders in law enforcement have been called a lot of names, and some of you, over the past weekend. And a lot of you know me and your local law enforcement officers. They know we care. I take this to heart. While this is an issue, while I wish this issue never came up, it's turned out to be very good, and it's created a discussion that needed to happen, and we will all learn from this. The reason for our non-public withdrawal from our department's support was due to a request for Embrace to not publicly support any movement that supports defunding the police. I've reviewed 2 articles that show on these issues about defunding the police. And again, while I got this from the media, I'm sure I don't have all of the answers or the complete picture. There is an attack on law enforcement, but not here in Barren County. And I think these comments by a partner in our department might be creating that feeling here, and I'm not okay with that. Again, I was trying to show Embrace that this could be an issue. I did not ask them to stop advocating or serving anyone. Why is this important? Because these are the cops they partner with, and partnership is made out of trust. The request was made for them to focus on local advocacy, not problems that exist in other areas. This was about defueling extreme polarization in order to cultivate and foster a necessary partnership. The counties Embrace serves are not statistically diverse, and more importantly, there is no evidence of racism in law enforcement in our local area. Again, if there was, it would not be tolerated. I would hope they concentrate their efforts on our drug and alcohol issues. That's our majority of our domestic cases. Just like one victim not being served because of a sign or an issue, one person being discriminated against is one too many. Their extremely firm stance on this feels like an act to attempt to marginalize the law enforcement agencies who respond to domestic situations, our most violent and dangerous calls we respond to. I skipped the line. I'm also not saying that racism doesn't exist, because we're not diverse. We can all learn and we can all be better, including law enforcement. That's why I'm launching a citizen advisory and action team for the department. I'm creating a diverse team that will advise and challenge not only me and our department, but this community. There's a lot of passion when I talk to people. That was pointed out to me. It's my job to bring them together. Well, I'm going to do that. There was also a lot of hate and anger, a majority from outside of this county. and we have to deal with that also. We will talk and tackle local social justice issues and other issues in Barron County. I'm working on a grant to allow this team to be able to take action, maybe bring a speaker in, educate the community, create a flyer, or have a picnic with law enforcement in the area or in an area of the county that may feel neglected, uninvited, or a way to engage with them. I plan to have a member of the St. Croix tribal community, the Somali community, the African American community, a student, faith-based, Amish, Mennonite, a recovering substance abuse, homeless was brought up today to me. I think they're all great issues and we're gonna move forward with that. There were several people that sent me notes and comments in a very professional way that helped me come up with this idea, so I decided to reach out and take some action. I hope this will be successful so we're never in this spot again. One thing I will note is that I stand with and for law enforcement, and that stance we took with one of our trusted partners, and I hope they reflect on how we feel. We can all do better, and we will. I'm also glad that people continue to support Embrace. I worked with them for over a year to gain this awareness, and I'm very happy for them. Thank you for your time, as we were all pushed to the limits emotionally among this pandemic and other political issues. I am committed to working towards a solution on this issue that continue to protect the victims, work on social justice issues, racial inequality issues, and protect our law enforcement. This is not about a win, but to find a common goal to move forward together. We will stumble, emotions will get the better of us sometimes, but that's okay, because there'll be others to help us up. Anyone who wanted to serve on this action committee can submit a letter to me. It's on our Facebook, it's on media, the local media has picked up this story. I'm very excited about what we're doing. The response we got this afternoon for this action team has been overwhelming. We already have, I have 10, I could close it today, I have 10 of the cross section of this community already applied for this position, and I know many more will. I just can't tell you what this has done. I wish we weren't here, I wish we weren't talking about this, but you know what, I'm glad we are. And I think that's what's important. So this went out to the media, our local media called me on this afternoon, it's all taken care of. We're working towards a solution and we will get there together in Barron County. Thank you.
Thank you, Sheriff. What the sheriff didn't mention is he got professional emails, but there were a lot of them that were very unprofessional and very hurtful. And I know some of you are aware of that, but I'm glad that Sheriff put this out. And I can tell you that our Health and Human Services Department, our Sheriff's Department are two of the best in the state. And if we can't trust them to do what's right and handle this matter, nobody's going to do a better job than them. So thank you and keep up the good work, Chris. Okay, item number 5, approve the agenda without items number 7 and number 8. Motion by Supervisor Olson, second by Supervisor Gore. Gores, is there any other discussion? Not, all those in favor of approving the agenda without items 7 and 8 indicate by saying aye.
Aye.
Opposed by saying nay. Okay, the agenda is approved. Item number 6, approve the minutes of the September 22nd, 2020 meeting. Motion by Supervisor Heller, seconded by Supervisor Rinzig. Are there any concerns? Not, all those in favor of approving those minutes indicate by saying aye.
Aye.
Opposed by the same sign. Okay, that motion's carried. Okay, item number 9, a presentation on health, Joy. Jody's doing that?
Joyce, you have it all queued up?
I'm working on it.
Board members, what we're going to have is a presentation from Mr. Jeff Dorfman. He is the senior salesperson or senior vice president for Health Joy. And this is the act. At the end of this, I would hope that the county board would make a motion to authorize, and maybe Alex should speak to this when this is done, if it's okay, Louis. But I believe it's going to be his recommendation that we agree to a 2-year contract and use this health app. So with that, I'll turn it over to you, Jody and Jeff. I get it.
All right. Well, good evening, everybody. Thank you so much for having me at your meeting this evening. My name is Jeff Dorfman, and it's a pleasure to be here.
Just trying to do too many things at one time.
Guys, can everyone see my screen? Hello? Okay. Can you guys hear me? Testing 1, 2, 3. Ah, testing 1, 2, 3. Can everyone hear me?
Okay, I'm unmuted.
Testing 1, 2. Can you guys hear me?
Sounds good.
Awesome. Good evening, everybody, and thank you again for having me at your meeting. My name is Jeff Dorfman, and it's a pleasure to show you HealthJoy. I'm going to go through a couple slides as to the why behind HealthJoy, but I'm going to spend the bulk of my time showing you the app. The idea is to make the benefits experience a lot easier for employees and help them make better decisions with their healthcare, which will bring down the cost of benefits long term and also create healthier and happier employees. So I'm going to jump in. If there are any questions, please feel free to interrupt me. It's my pleasure to answer any question you have. So there are many different ways in which you can try to control costs when it comes to benefits. And you can see a few on the screen, and some are more popular with employees than others. Some are short-term solutions, but many are long-term solutions. We believe the best way that you can affect the cost of healthcare long-term and affect tomorrow is by making employees better consumers of their healthcare. And I mean that on two levels. First is ensuring employees visit the facilities and the providers of the highest quality and lowest cost, but also that they stay proactive with their health, such as reminding them to go to get a flu shot or a wellness exam. And if we can help in those areas, we believe that's a win-win. The problem is the current experience doesn't really lend itself to truly getting employees to understand their benefits. I have no doubt you have great open enrollment meetings, and there might be emails that trickle throughout the year. The problem with any meeting and any email is that you're throwing a lot of benefits and information at me at once. And unless I need all of those benefits at this very minute, I'm probably not going to remember much of what you told me 3 hours later, let alone 3 months later when I actually need one of your services. And it's not just the details of the benefits I don't remember, but how and where to access that information that I've also forgotten. And this can truly create a poor member experience and can really cost a lot of money in the long run. So we believe there are 3 simple changes we can make to positively affect this. First is that we are going to centralize all of the benefits information in one place. And we're going to put it on something that all of your employees are carrying around with them at all times, even when they're not supposed to, and that's their smartphone. Secondly, we're going to take all the heavy lifting and the guesswork out of their benefits. Employees will not have to navigate any of their benefits. We're going to do it for them. All they need to do is answer a couple questions, which I'll show you. And finally, and we consider this our secret sauce, we are going to communicate with your employees monthly by sending push notifications to them about different types of messaging, from staying healthy to advertising our services. But you will also have the ability to create your own push notifications if you want to have your own specific messaging as well. We know these work, by the way, because 1/3 of our members are visiting the app on a monthly basis. We have more than 250,000 employee lives on the app alone, and 1/3 are coming every month. I can assure you 1/3 of them are not sick. So that means we're doing a really good job of driving people to the app. In fact, last month, it was 38%. And this is where HealthJoy comes in. What you're looking at on the right is what we call our benefits wallet. you'll see that we've created a card for every benefit and service offered to an employee. But we're also agnostic. So if you change carriers or programs, that has no bearing on this product. But we're going to do so much more. We're going to find a facility or a provider of the highest quality, lowest cost. Review a medical bill. 75% of the time, we find some type of error with a bill or an EOB. Review a prescription to find a lower cost alternative. And finally, answer any benefits question an employee might have. The final slide I'll show you is first how we communicate with the employee, and then I'll show you the app. So this is an example of acute message advertising our telemed. But if you look on the right, you'll see that we actually take the employee to the app, and we're having a dialogue with him or her. We'll even direct them to a specific service. So it's not just like getting a message on your phone, it's actually bringing you to a journey and engaging you. And that's really what separates HealthJoy. So I'm going to exit out of this and show you my phone, which disappeared. So just give me 1 second. It'll be up in 1 second. There we go. Does everyone see my phone on the screen?
Yes.
Perfect. All right. So here's the HealthJoy app. And if you look at the very bottom, I'm pretty much going to go from right to left. I'm in the least exciting screen, but I do want to show you my profile for a couple of reasons. You can see that my wife, Michelle, and son, Jacob, are listed. The app is for the entire family, but you only pay for your employee. Any spouse or dependent over 18 can have their own app, under 18 or on a parent's. But better yet, let's say Michelle was not on my health plan. She was on the plan through her employer. She could still use HealthJoy for free. Now, she'd have to take a picture of her card if she wasn't on my health plan the first time she used the service, but she'd have the full suite of services. And then in plan benefits, we are going to have accumulators that will keep me up to date on my deductible. So if I spend $100 tomorrow, next week I will literally see under individual, it would be $900. And many employees don't know where to go to see their deductible information. And then we're going to give the employee a rundown of his or her specific health plan. So this is a nice plan. If I want to visit my doctor, it's a $25 copay. The cost for my prescriptions, preventative care is free, and all other services listed in one place in the app. So let's go to the wallet. This is the #1 place employees visit. And I had mentioned more than a third are coming every month. I do want to touch on a couple cards. First is telemed. Telemed is included in the app and it's free. We use a third party called MeMD, but it is seamlessly integrated into the app. Your employees automatically have access to it and their families as long as they have the app. There are no other additional steps to take. Most importantly, because it's outside of your health plan, a visit never counts as a claim. Our average utilization rate is 35%. Compare that to nationwide averages of 5 to 7%. And it's because we have many ways of driving employees to this one service. My medical card. Employees will no longer have to ask for a card before they go to the doctor. All of their benefits cards will be here on the wallet. Many carriers are going to electronic cards, so it's not that novel of a concept anymore. Now, this is a demo account, but all pertinent billing information would be on this card. And then any other service that I've either enrolled in or entitled to as an employee will not only have a card, but could have links that would take me to more information on that benefit. And we receive this information every year, anytime there's a change. So this is completely up to date. And in the finance card, I can even see my up-to-date totals or balances for individual accounts such as a 401k, a 403b, FSA, HSA, etc. So let's go to the menu because this is where all the action happens. I'm going to go into a provider search. And I choose that because that happens to be the #1 service employees utilize through the app. But as you can see, not only can I access telemed again, but I can look for a facility or a procedure, find a lower cost prescription, even have a medical bill reviewed, as I had mentioned before. So I'm going to say, I'm going to look for a new doctor. And at this point, I am speaking to AI. This is artificial intelligence, our chatbot we call Joy. 95% of our members start this way. Our members are of all ages, all lines of work, and from all parts of the country. The other 5% either call us directly, so there's a card in the benefits wallet with an 800 number, or they can go through a live chat in which they're literally chatting with a real person and they see their picture and their name. However, most employees choose those options when they have a general benefits question they want answered. So the first question, who in my family is this for? I'll say it's for me. So let's say I was referred to a doctor by a friend, or even my physician referred me to an orthopedic surgeon. You know, just because I'm referred doesn't mean that that doctor is in network. So if I hit referred confirm, type in the doctor's name, we'll check to see if he's in network, of great quality and fair price. And if the answers are yes, we'll just ask if you want us to set the appointment for you. If the answer is no, we'll tell you so and ask if we can conduct a whole new search. So no one's referred me. We'll move on here. It's a little stuck. Let's see what happened here. See why that didn't work. I'm in my demo account, so there must have been something there. Let's go back. All right. So because I said I want to find a new doctor, the next question is, what type of provider am I looking to see? And as you can see, this can be used for anything. I most recently used this to find a new dentist because mine retired. I'll just say new primary care doctor. And these are great reasons to see a primary care doctor. I'll say that I'm in some type of discomfort or pain. There's a reason I'm picking that one. So we just want to make sure it's not a medical emergency. If it is, please don't go through an app. I think we can all agree with that. So more than 99% of the time, people are going to hit it's not an emergency. So because I said it was not an emergency, we're actually going to halt the search for a second. And we're going to say, hey, Jeff, did you know that common conditions can be treated by a medical professional 24/7 through the app and it's free? Or in this one, my employer is charging $5. Would you like to talk to someone right now? So even if I've ignored other ways of getting to telemed, this is right in front of me. And I will tell you that this redirect is good for half of our 35% utilization, meaning we're getting people to use a service that's a lot less expensive and a heck of a lot more convenient just by looking at this screen alone. So I should hit yes. We'll just say that I have sinus pain. That's life in the Midwest, but I'll say no, that I want to talk to a doctor. If I hit yes, I'm redirected. The average wait time is 8 minutes. But I want to see a doctor, so they want to know what my issue is. So I'm going to say that I have sinus pain. You can take a picture of your ailment, but there really isn't a good way to take a picture of sinus pain, so we'll hit skip. I generally just complain to my wife. She doesn't appreciate it, but you know, anyways, I tell her it's part of my charm. Our last two questions are two of our most popular features according to our members. The first one is employees can plug in any preferences that are important to them in the search for a doctor, such as free parking, how far you're willing to travel in miles or drive time, gender of the doctor, language, anything. And then our final question is, where would you like us to conduct the search near? So that's my home address. But you know, not everyone lives right around the corner from where they work. And maybe I want to go from work. So I can hit another location and type in my work address. That's the address we'll use. Or let's say I was at your meeting today. And even if I got there safe and soundly, I'd have no idea what the address is. I'm just being honest. So I could literally hit GPS location. Healthjoy would find me in 2 seconds. And that's the address we would use in the search. And that's it. I can tell you when I'm not going through the play-by-play, you could zip through this in 30 seconds. If I hit yes, now this is going to our concierge team. That's where real people are taking over. Already built in from when you guys started with us would be your the health plan, the employee. All of my benefits are going to be embedded into our program so that we can conduct the search. And we're using multiple quality indicators to study quality and cost as well. But we don't stop there. We then get on the phone and we call the facilities that we're able to narrow down from our original search. We confirm that they're still in network because that can change. We confirm the price. Now, that may not be as important to go see a doctor over sinus pain, but that most certainly is if I needed a knee operation or I needed an MRI as an example. Are they accepting new patients and do they have availability? And based on those answers, we would then send your employee a push notification with a referral. And I can see that Kelly from Healthjoy has referred me to Dr. Batista, and I have an alternative option in case I don't like Dr. Batista. I can hit chat or call to have a live conversation with Healthjoy about why they're referring this doctor. Or I can hit the arrow next to her name and see why. These are great reasons to refer a doctor. If this was for a procedure, it would have the cost for this procedure versus the fair cost in the area. It would also say something about quality. But we can take it one step further. We'll even schedule the appointment for the employee. If I hit schedule an appointment, a calendar will appear. I can give Healthjoy my availability in dates and times, even choose first available. We'll then call and schedule the appointment. And if we do that, then the employee receives another push notification with all of the information for the appointment, and they can even add it to their calendar on their phone. And that's Healthjoy. I hope you were impressed with it. I would be glad to answer any questions you might have.
Jeff, I've got 2 questions for you. What's the incentive for the employee to give the bill or the EOB to Healthjoy for review? And the second is, what is the greatest savings to our plan by utilizing your service?
So the first one is that the employees are writing a check. And if I have to write a check for $100 or a service should be free, which oftentimes happens, versus $900, that's a huge benefit to me. And you can say, well, they have to hit a deductible, but nobody wants to spend more money. And the way we also see it is that for every one person who blows through their deductible, there's another employee who never even comes close to it. So if I can save money, that's affecting my pocketbook. By the way, if I'm overpaying, then your plan is overpaying. As far as the incentive to the health plan itself, or what employees are using us most for. So I will tell you that provider searches is the #1 service that employees are utilizing through the app. Telemed is second. And if you think about the cost savings, on average is anywhere from $250 to $500 by being able to drive someone to telemed. And our average utilization rates are 30% higher than what they are nationally. That is a huge savings. Procedures is also another huge one for your plan, because if I can save hundreds or thousands of dollars on a procedure by going to an alternative option, it's a win-win.
Anybody else have any further questions? Alex, are you speaking to the cost of this, or is Jeff, or?
I would be glad to do that.
All right.
So the cost is $6.50 PEPM. You only pay for the employee, as I said. Spouses and dependents are free. Our average client experiences 5.3 times ROI, and most see that in the first 90 days of service with us.
So to put that in a little perspective, the cost over the 2-year contract period will be right around $42,000. Jeff Dorfman did give me a return on investment analysis, very conservative. We're expecting to save at least $60,000 in the first year alone. So you do that over a 2-year period, and we're expecting this program to easily pay for itself, if not, save a little bit of money for the health plan.
The 42 is for both years, so it's 21.
$21,000 a year. Obviously, that can change depending on enrollment, but
Right.
where we sit today, that's about.
And do you use HealthJoy quite a bit with your other plans?
Yes, so Horton has it. We are a client of HealthJoy. We've implemented this at several groups of ours. Just to recap some of the highlights on why we brought this to the county. First, understanding your benefits is such a huge deal. We come out once a year and help Rachel with open enrollment presentations, but a lot of times people don't understand how their benefits work. Getting an explanation of benefits and then receiving a bill can be confusing. HealthJoy can help answer those questions. And furthermore, we're hoping to take some work off of HR's plate. Hopefully they can answer more of those questions. We'll have constant communication so people can engage with their benefits over the course of the year. The telemedicine thing cannot be understated for your health plan to have a free service that people can utilize throughout the year. Being a high deductible health plan, oftentimes all of those services will apply to the deductible. This can now be offered at no cost. And the worst thing that's going to happen is the telemedicine provider says, we can't help you, you need to go see a doctor in person. It didn't cost them anything to engage that first step. And then I already mentioned the return on investment piece with the bill review, the prescription drug savings, which they will send a member to the nearest location at the lowest cost prescription drug. Again, your members are paying the full cost of that prescription until their deductible is met. So if I'm taking any sort of prescriptions, this HealthJoy can help me save money immediately on January 1st when we roll this out. So Horton believes in it. We're recommending that the county take the HealthJoy 2-year offer. We believe this plan will pay for itself. We're excited to roll it out. So are there any questions for myself?
If there aren't any questions, we need a motion to accept the approximately $21,000 a year for 2-year contract with HealthJoy, or say nothing. Are you making a motion, Russ?
I'll make that motion.
Okay, second. All those in favor of the motion indicate by saying aye. Aye. Opposed by the same side? We have motions carried. Russ and
Bert.
Bert. All right, are we on to, then thank you, Jeff, for the good presentation.
Thank you so much. I look forward to working with you. Have a great meeting and a nice evening, everyone.
Thank you. Okay, item number 10, update on the health insurance fund and the 2021 health insurance renewal. Alex, you're up again.
Okay, good evening, everyone. Thank you for having me. So I'm going to go through a couple pieces of information. I am going to try and keep it brief. I understand there's a busy agenda tonight, but there's also a lot of information, and I want to make sure that the county board understands how the health plan is running and what we're recommending and why we're recommending it. So this first page is what we call our reserve calculator. So you may remember that on January 1st, 2020, we moved from WPS fully insured to a self-funded arrangement with Anthem and PBA. So now that we are self-funded, we are essentially the health insurance carrier, so we get more information, and it's important to track how the health plan is running. On the top, you'll see all of our vendors listed. In the middle, we have our fixed costs, so that's the premiums we pay to PBA to administer our plan, and then our stop loss premium. Stop loss, for those of you who may not be familiar with it, is the secondary insurance product that we buy to make sure that if we have either large claims or a lot of claims, that we have insurance protection for those. So while we are self-funded, we still have insurance coverage for large claims. And then on the top right, we have our funding rates. So that's our premiums that the county and the employee pays. In the middle part of this chart is kind of the meat and potatoes of the presentation. So we have our plan experience, and it's listed by month. We have our fixed costs. So it's our administration costs. Again, that goes to PBA to administer claims. Our stop loss premiums, that goes to Anthem to cover our both specific and aggregate coverage. So then we add those two together and we get our total fixed costs. So last year when we were with WPS, you may remember that our premiums were about $5.2, $5.3 million. Now that we are self-funded, thanks, Jeff. Now that we are self-funded, our premiums are cut down to about, let's call it $1 million through the first 9 months. So it'll probably be about 1.3 by the time the year is all said and done. So much less in fixed costs. Then the next part of the chart here is the variable costs. And this is where we pay our claims. We have our medical claims. That's every doctor visit, inpatient stay, outpatient stay. Our prescription drug claims, going to Walgreens, Target, et cetera, for our prescription drugs. We add those two together and we're going to get our total variable costs. Now that we're self-funded, we get reimbursed for claims that are over $50,000. So I mentioned we have insurance, stop loss insurance for large claims. Our deductible for every member on the health plan is $50,000. So if I have a medical claim worth $75,000, the county is responsible for the first $50,000. The health plan would be reimbursed by Anthem for the other $25,000. You'll notice that through the first 7 months of the year, we didn't have any reimbursements. The last 2 months, August and September here, we had a few claims go over our specific deductible amount, so we are beginning to receive reimbursements for those claims. So we add the medical and the prescription drug claims together, we take out the reimbursements, and we get our total variable costs. We add our variable costs to our fixed costs, and we get a total plan cost. So this is what the plan is spending on a month-by-month basis. Then we take your enrollment. These are all your employees, and they're single, employee plus spouse, employee plus children, or family. We get our total contracts, and we take all of this and we multiply it by our funding rates. So our funding rates, this is kind of, look at this like what we paid under WPS, what our premium is. That also remains relatively stable. That's based on enrollment. We take all of that, and then we take our claims, our total cost versus our funding, and we get a monthly loss ratio. So you'll notice the first thing I want to point out, because it's going to be important when we talk about the budget, in the month of January, our loss ratio was 30%. So for every dollar we took in, the plan only paid out 30 cents. That's because we didn't have a full month of data, right? It usually takes, besides prescription drugs, that's point of service, but if I'm going to the doctor's office, it's going to take about 2 to 3 months for that claim to work itself through the system. So really, we don't get a complete picture on what's going on until about March. And then April, 59, 63, et cetera, et cetera, et cetera. So through the first 9 months of 2020, and again, it's not a complete picture because we just transitioned to self-funding, but through the first 9 months of the year, we're showing a 65.9% loss ratio. So again, for every dollar paid in by both your employees and the county, we've paid out just under 66 cents. Right here in the bottom middle, we break it down even further. So we have our total plan costs, our funding amount, and we get a dollar difference. So that 66% loss ratio means that in our surplus, in our reserve through the first 9 months, we've been able to accumulate $1,375,000. So that's much higher than we anticipated when we moved to self-funding. I told the county board last year when we recommended moving to self-funding that we want to get to a point where we have 6 to 9 months of expected costs in reserve to help manage the ebbs and flows of running a health plan. We estimated that dollar amount based on where we were with WPS to be right around $2 to $2.5 million. We expect to do that over a maybe 2 to 3 to 4 year time period. Because of a lot of factors, COVID being the main one, and then it being an incomplete year with just transitioning, we're a little bit ahead of schedule But it was a good year to move to self-funding. We kind of got lucky in that regard, and so far the health plan is running fairly well, and we've been able to put some money into that reserve account right away. I'm going to pause here briefly to see if there are any questions.
Alex, would you just please mention if this is appropriate time that what the anthem, the stop loss?
I'm going to get to that when I do the budget.
Okay, thank you.
Any other questions? Okay, Jody, if you could scroll down to the next page. The other thing I wanted to include in this presentation is a snapshot of the large claims. Everything here has been de-identified, so there's no public or personal health information or anything that violates any confidentiality rules. But being self-funded, one of the main factors we need to be concerned about is what claims are hitting a specific deductible. So here we look at any claim that has been paid at over 50% of the stop loss deductible, which in our case would be $25,000. When I first began going through the budget process with Jeff, this list was only a handful of people long, and most people at that time have not met the specific deductible. As the year has gone on, this list is continuing to grow. And if you remember last year when we were with WPS, I believe we had something like 25 or more members that had over $50,000 in claims. Currently, through September, we have 6 individuals who have had more than $50,000 in claims. That comes out to, I believe it was on the prior page, about 90. So far, we've received $65,000 in reimbursements. Obviously, we've had some new members hit, so that reimbursement will continue to tick up. And we have several other members that are close. So we've had some uptick in significant claim activity. I wanted to point that out because it is important when we talk about the stop loss removal and other budgetary items. So any questions on that? Otherwise, we'll move on to the budget and what we're recommending. Perfect. Okay, so I'm also going to walk through this in a little bit of detail. It gives you a little peek behind the curtain at how the sausage is made here. So this is our budget projection for 2021. And what we do here is I'm going to go down the left side of the column first, and then I'll talk about this stuff here on the right. So the first thing we do is we look at the paid medical and prescription drug claims over the last 12-month period. So because we have claims through September, we look October through September, and we've had $3 million in claims. Then we pull out any claims over the deductible that we've been reimbursed. One little kind of asterisk here, when we were fully insured with WPS, we didn't get a great feel for when we may have had some of those large claims hit. So we annualize those amounts and then divide it by 12. So because we're looking at claims from October of 19, we have 3 months, October, November, and December of 19 still in there. We had to add those in. So we add that to our reimbursements for 2020, and we had $382,000 pulled out. So that gives us our new adjusted claims number. So we take 3 million minus 382, we get 2,658,000. We then have to add in trend or inflation in our world. That's going up roughly 5% annually. So we times it by that factor. Our new projected claims is $2,824,129. A laser would be a higher specific deductible on an individual should they have some serious ongoing conditions. I'm happy to report that our stop loss renewal anthem did not contain any lasers, so we don't need to add any additional liability. We get our new estimated claims number. We add in fixed costs like our consulting fees, and then our stop loss and admin fees, and then we get an estimated claims plus expenses. So what we are projecting based on the last 12 months of data is $4,268,000 worth of expenses. Our income at current rates, so our premium rates, is $5,363,200. So that if we wanted to zero out this number, we'd be calling for a 20% decrease. However, I want to be very clear with our recommendation. We are not recommending taking a 20% decrease. There are 2 main reasons, actually 3. The first is it's not a complete year. The month of January and February were artificially low. Two, COVID-19 hit, and that had a large impact with health systems shutting down, people not seeking care, a lot of different reasons that lowered claims. And then lastly, as I mentioned, under the reserve calc, while we're projecting, or while we have, $1.3 million in reserve today, for us to be comfortable to run your health plan on a consistent basis without kind of the roller coaster ride of increasing and decreasing premiums, we want that number to be between closer to $2.5 million. So what the Horton Group is recommending at this time is that we leave health insurance rates alone. We take a 0% increase, we leave the rates the same for another year. So our recommendation would be to strongly consider leaving healthcare costs the same for 2021. Before I open it up to any questions on this document, I did want to talk about the fixed costs. We do have our actual renewals from Anthem and PBA in here. So we have our admin costs. Those went down slightly. It's not big dollars. We're talking, a couple thousand. Our stop loss premiums did go up by 8.9%, and our aggregate premium went up by 2.5%. The stop loss renewal at 8.9 is very fair. Trend in the stop loss world is at right around 15%. So we're below trend. And as I mentioned on the large claim report on the page prior, we've had an uptick in large claim activity. That's only going to get worse for the last 3 months of the year. So I thought that the 8.9% increase and no lasers was a very fair renewal. So I'm recommending that as part of our package that we are recommending that we also accept the Anthem renewal. So with that, I will pause for any questions.
Cody, so everything that Alex just went through, you have incorporated in our budget?
Yes,
We've already presented to everybody and
yes.
and vote on next meeting.
I got a question. What do you call, when you're sitting there talking about 5% on inflation, is that the 5% of what the costs of what the health facilities are raising their costs every year?
Yes. So when we look at trend or inflation, if you go to the doctor today and it costs $100, we would expect that exact same visit next year to cost $105 due to innovation, prescription drugs, specialty medication growth, all of those types of things kind of build in, and just inflation year over year, health costs continue to go up. So that's what I'm talking about.
Any further questions for Alex?
Yep.
Bob?
Well, I don't know that Alex can answer this, but we've been kicking around a lot of numbers here. What about employee feedback on this? Have we had any of them?
He wondered if he went over these numbers with the employees.
No, I don't care about the numbers. Did the employees, do they appreciate this new take on health insurance?
On the plan. Yes, we haven't had any complaints.
Well, that's what I'm asking, if there's been any feedback of any kind.
Rachel Ritchie's here, why don't we ask Rachel? That'd be the best source.
Right, so I mean, health insurance is,
Down here.
is a
Yeah,
tough
very
one.
used.
To say that everyone is excited about health insurance would probably be not the right statement, but I think overall, and Alex, you can probably echo this, really employees with our change, employees other than it was a new provider and a new ID card, they didn't really see, the self-funding bit doesn't really matter to them, or they don't really see that change. And so I think there were some good changes, different for pharmacy benefit manager. But again, with that being said, if you polled all, 300 employees, you would hear, I don't like this, I don't like that. But in general, I think it's been positive. They are appreciative that, rates have been able to stay consistent, the opportunity to sell vacation and sick leave to their health savings account, and just, kind of some differences, I think that with a larger network and a broader network. So I'm not hearing a lot of things to the negative either. However, again, with that being said, certainly to say 100% that people are, love every bit of it is probably, I don't know, maybe you have vendors who if you figured out that way, we maybe wouldn't. But does that answer your question, Bob?
Yes, it does.
Okay.
Are there any further questions? Either Rachel or Alex? If not, thank you, Alex. Oh, sorry.
How far are we in the traveling point? I mean, are we going as far as 50 to 100 miles away from this town or city area?
It should not be. So by using the arrangement with PBA, we have access to Anthem's network. So Anthem is the largest insurance carrier in the country. All of the major providers in this area, Marshfield, Mayo, they're all in the network. So really people shouldn't have to travel too far. I understand it's more rural part of the state. However, we do have a very broad network. People need to go to the Twin Cities or down to Milwaukee or, wherever, Madison. We have coverage everywhere. We have a national network. They even have international coverage should they need it. So we have a very broad-based network being with Anthem.
Does everyone join? All the employees? Do they have to join or do they?
They don't have to join. The last month, we had 250 of, how many employees that are eligible?
Like 285.
So vast majority are on the health plan.
Any further questions? Not, thank you, Alex, you did a great job.
Thank you.
Okay, item number 11, the zoning ordinances. We have 2 of them there, and Jeff, there are any concerns? Can I get a motion to approve those 2? Motion by Supervisor Thompson, second by Supervisor Skog. Are there any discussions or concerns? Not all those in favor of approving those 2 rezonings indicate by saying aye.
Aye.
Opposed by the same sign, and motion is carried. Item number 12, resolution, adoption of the Barren County Farmland Reservation Plan Map to the town of Stanley for 2020. We've done that in the past, and I think it's just because we're doing a lot of the farm preservation credits and trying to get more into the Ag 1 utilization for the farmers. So we get a motion to approve that to the resolution. Motion by Supervisor Gore, second by Supervisor Rogers. Is there any discussion? Not all those in favor of the resolution indicate by saying aye.
Aye.
Opposed by the same sign? Yeah, motion's carried. Item number 13, the resolution of the Shutek Snow Flyers loan. Okay. Okay, we'll need roll call 2/3. I know the property's aware of this, exec's aware of it, but what went on is back in, I think it was June, the property committee decided to take a pause on doing these loans to the snowmobile clubs because we didn't know what our sales tax was going to be. We didn't know what COVID expenses were going to pop up. We didn't know what our real estate collections would be. So we thought we'd just wait till the end of the year and see how we're setting. Well, in the meantime, we know how we're setting. Our sales tax is up. The real estate taxes is up. Health and Human Services is doing a great job with grants and programs, and they got the COVID expenses under control. So there was really no reason to not do these loans, and it happened to be a lot of the clubs actually wanted to buy new equipment. So we revisited that with both property and exec, and they said, no, let's go ahead and do these loans. As almost everybody's aware, snowmobiles and the ATV sales are going through the roof. It's a form of recreation and tourism, and I think the clubs like it because it's a win for them, and we help them out, and we've got the fund balance to be able to do that. That's the background. So I guess we get 2 loans separately. The Shutek Snow Flyers are taking $100,000 new loan, adding on to the almost 50 of the others, so it'll be $149,000. We've never had any qualms with collections or anything, so I guess I need a motion to approve that loan to the Shutek Snow Flyers. Motion by Supervisor Renzig, second by Supervisor Heller, and I guess we have to go roll call and get a 2/3 approval.
I got a question.
Yep.
We call them, if I read that right there, we call them the snow, Shutek Snow Flyers here, they were going to spend $212,000.
Probably, that's how I have to
And
look
so
at
they
it.
were putting up that much money or what?
Yes, they have money of their own. It's in the detail, which I don't have right in front of me, but yeah, there'd be an invoice that they would have put some money down on as well.
All right.
And I believe that they traded in something.
What's that?
I believe they traded in a piece of equipment, so that's where the
I
difference
got
was.
Both of them traded in stuff, and they're good quality new stuff, but what the heck, want to do a good job for the clubs, and I think it's been a good situation. Okay, any other further questions? No, we'll take a roll call.
Bert Skinner,
Yes.
Dale Heinke,
Yes.
Bob Rogers,
Yes.
Oscar Skog,
Yes.
John Banks,
Yes.
Terry Lee,
Yes.
Carolyn Bartlett,
Yes.
Pam Fall,
Yes.
Bill Stradle,
Yes.
Gary Taxall is absent, Jim Gores,
Yes.
Gary Nelson,
Yes.
Berta Mosentein,
Yes.
Pete Olson,
Yes.
Steve Johnson,
Yes.
Carol Moen,
Yes.
Eric Panyard is absent, Uyoki,
Yes.
Russ Rinzig,
Yes.
Todd Gerlin,
Yes.
Barry McRoberts,
Yes.
Mark Thompson,
Yes.
Von Hansen is absent. Stacy Bunzel,
Yes.
Rena Heller,
Yes.
Bob Anderson,
Yes.
Dan Buchanan,
Yes.
Don Horstman is absent. Bill Efforts.
Yes.
Okay, so we've got 25 yes and 4 absent.
Okay, so that motion carries for that resolution. Then item number 14, resolution for the Rice Lake Snow and Dirt Club loan. They're looking for $115,000 of new money, coupled with $43,000 existing, a little over $158,000.
We have an ask, please, that line number 24 of the resolution on page 1 be reduced to 112,000. They have come up with more money, so there'd be two changes. Line 10 would go from 115,000 to 112,000, and then line number 24 would go to 112,000. I'd like the motion to reflect that if it's the wishes of the board to approve this. So I have no concerns with approval, neither does Jody, but we just need 3,000 less.
Can I get a motion to that effect? Motion by Supervisor Buchanan, Carol, a second. All those in favor indicate by saying aye.
Aye.
Opposed by the same sign? That motion's carried. Oh, geez, sorry. 2/3 roll call.
Dale
Sorry.
Heineke,
Yes.
Bob Rogers,
Yes.
Oscar Skog,
Yes.
John Banks,
Yes.
Terry Lee,
Yes.
Carolyn Bartlett,
Yes.
Pam Fall,
Yes.
Bill Stradle,
Yes.
Gary Taxall is absent, Jim Gores,
Yep.
Gary Nelson,
Yes.
Berta Mosentein,
Yes.
Pete Olson,
Yes.
Steve Johnson,
Yes.
Carol Moen,
Yes.
Panyard is absent, Uyoki,
Yes.
Russ Rinzig,
Yes.
Todd Gerlin,
Yes.
Terry McRoberts,
Yes.
Mark Thompson,
Yes.
Von Hansen is absent, Stacy Bunzel,
Yes.
Rena Heller,
Yes.
Bob Anderson,
Yes.
Dan Buchanan,
Yes.
Don Horstman is absent, Bill Efforts,
Yes.
Bert Skinner.
Yes.
So we've got 25 yes and 4 absent.
Okay, so that resolution passes. Item number 15, the resolution supporting application for 2020 grant funds to create Barren County buffers for water quality program. I know Jeff had the information in there, but we're looking with a $200,000 grant, and there's a 25% match. Are they gonna do that through in-kind?
Yes, that's my understanding, it's going to be through in time, and we wouldn't get this until 2022. So we'd have a whole year to plan for this, and, if they're gonna pay 75% of anything, I'm gonna
Right.
apply for it.
Right.
And I know that this is a good thing, I know Mr. Flores specifically for Crystal Lake, this is a big thing for the Crystal Lake. Staples Lake, district, so we're looking at, this is a big water quality issue. And I know if they have complete support of LCC extension, they're 100% in favor of this. Again, it's just a grant application, we'll deal with it if we get it. Good question.
Okay, is there any further questions?
We
If
just
not,
need
get a
50%, simple majority.
motion by Supervisor Skinner to approve this resolution, second by Supervisor Stradle. Any further discussion? If not, all those in favor of passing that resolution indicate by saying aye.
Aye.
Opposed by the same sign? That resolution's carried. Item number 16, telecommuting opportunities and telecommuter forward certification. Do we need anything for that, Jeff?
Nope, we just need, if the county board's so inclined that Dave Armstrong would really like to see us do this, and City of Chetek has already approved this, and we'd like to get on board with that so he can do some things economically, from an economic development standpoint, to say we're a telecommuting county.
So it's really approving that certification.
Yes.
Okay. Can I get a motion by Supervisor Bartlett, second by Supervisor Lee? Any further discussion? Not all those in favor of approving that certification indicate by saying aye.
Aye.
Opposed by the same sign? That motion's carried. Yep.
Item number 17 is quite a little bit different. All that Mosaic is, this is a very important resolution because Mosaic is looking at possibly getting a $6.2 million federal EDA grant to create a high-speed fiber line from Barren to Turtle Lake to Spooner, and then back down. Over 260 some businesses will benefit from this. So this is a big deal to them, and I believe their in-kind contribution is $1.2 million. So they're also putting some money in. So it's very important to them that this get approved by our county board, because then I plan on submitting this approved and signed resolution to the Wisconsin Counties Association to have them get on board and piggyback. So, Mosaic gets this. This is a big deal for a small co-op who's really trying to up the game and help everybody. So it's different from the telecommuting. This is financial and long-term economic viability for people to get high-speed internet to those lake homes, and they'll probably live here.
Yeah, as you know, rural broadband is one of the big things of, it used to be, as Bob Anderson will tell you, it used to be for real estate location. Now I think it's internet. So if you've got it, people want to come and move here. So it's a real big push for it, and this would be great because there's no better partner than Mosaic. They've really helped us out in tough times, and they're good local corporation. So I hope we got, item number 17 is actually a resolution supporting Mosaic Technologies, Inc., the Federal Economic Development Grant application. Can I get a motion to approve that? Motion by Punky, seconded by Carol. All those in favor indicate by saying aye.
Aye.
Opposed by the same sign? That motion's carried. Item number 18, the 2021 budget, the published draft.
Yep, we're ready to go if you are. I'm not gonna put down is that right, Louis? Do you need the big screen down? We've seen all this?
Yeah.
You want to just keep it up?
Yeah, keep it up.
Okay, that's what
Unless anybody
Unless
doesn't want
somebody.
to see me.
Okay. We'll keep him awake, folks. You don't want him dozing off when he's up there. So let's take my pointer. So there's 3 parts to this, county board members, and I'll tell you what they are. I'll just give you a little brief introduction about this year's budget. I want to tell you the 3 things from a high level that are driving the budget. And that is the number 1. Well, in no particular order. Number 1, our out-of-home placements have went down substantially, and controlling those costs have given us the opportunity to do some things, and we're going to get into those details in a minute. Number 2, our sales tax has stayed healthy, and I'm going to give you that number. If we'd have been talking here where our sales tax had went down, we'd be talking a whole different budget. 3rd, and I wish Alex was here, is our health insurance. We took a big gamble, and it paid. I mean, you're talking being able to put $500,000 away instead of having to pay $500,000. So those are the 3 big drivers for this budget that we're going to try to talk about. Second point is, and Jody's going to take over in just a minute, we told this board we would tell you the changes from month to month. And Jody's going to walk us through that. She's going to start with the budget publication and then the specific changes from September to October, and they are very little. So Jody?
Okay. So per state statutes, the executive committee has to recommend a budget to the county board. And then once that's been recommended, we publish it in all 5 of the papers. And per state statutes, it has to be in a special format. So what I'm going to show you looks a little different than the regular spreadsheets that we look at, but it's the way that it needs to be. And then from when executive issues or gives the recommendation until after the public hearing, the budget does not change. So we're just kind of sitting right now waiting for that public hearing. And then after that, then it will go to you, and then you can decide if you want to make any changes, if you want to approve it. And so that's kind of where we're at right now. There really this year has not been many changes, and so we'll get into that in just a moment too. So basically, this is the budget publication that was put in the papers. So looking at the general fund, looking at a 1.96% increase with just general fund activity. You can see that $3,700,000 in sales tax. That's where that's going to be budgeted. And then also the use of $1,020,000 in excess sales tax is applied. Each of these are by function. And the contingency is also considered part of the general fund for these purposes. So that's also included in here too. Going down with this, we have to have a projected fund balance of where we think we're going to be as of 12/31/2019. This is actual. Our actual fund balance then was $19,336,570. Projected is $17,836,680. The big difference is in January of 2020, we moved the $920,000 that we had been holding, that we'd been saving for to help get our self-funded health insurance started. We moved that out of the general fund and into its own fund. We also, the $303,000 that had been budgeted and we had been holding on the balance sheet to get started with the engineering costs for the highway department, that also was transferred over into a capital projects fund. So that's where the main difference is that, shows where this decrease is. Looking at the budget. So this is where our estimated fund balances are for each of the different types of funds. Here is revenues that are budgeted, expenditures that are budgeted. Typically revenues and expenditures balance, but here it looks a little different because with capital projects, we are not budgeting for tax levy dollar for dollar. We would be just levying $750,000 and the remainder of that would be use of fund balance. Also in the highway department, $1.5 million of excess fund balance from before is actually going to be applied to the 2021 budget to be used for construction projects. And so you can see estimated fund balance as of 12/31 is about $37 million, or just under $38 million, excuse me. With a property tax levy of $22,199,961, and which is a slight increase from 2020. And this is with the budget with the new positions was recommended. And so this includes those new positions, the one full-time position in the sheriff's department, and then also the 6 new part-time positions in recycling as we transition to those manned recycling sites. Equalized valuation is listed, as is the mill rate. You can see that the mill rate's going from $5.05 to $4.87 per thousand. And looking at that $30 recycling surcharge for each improved parcel in Barren County. Is there any questions? If not, we'll move to the changes. So since September, we increased the uncollectible taxes expenditure line by about $75,000. After tax collection, there are in the municipalities, there are some personal property that is delinquent. And some of this has to do with some of those sand companies. And so the county will end up having to pay 20% of that next year if they do not pay. So, we're looking right around $80,000 for that. We had originally budgeted $5,000, so we had to increase that $75,000. The offset is reallocated. We changed the fund balance, our excess fund balance a little bit, and we'll show you that in a few moments. We reduced the dog fund from $30,000 to $22,000, just basically that no effect to tax levy at all. Just basically more in line with the last couple of years of what we've received with collection for those dog licenses. Increase the museum appropriation. This was a one-time increase of $4,000, which is offset by reallocated excess fund balance. They've really had a tough year with COVID over at the museum. The executive, again, recommended that additional sheriff patrol position. The total amount for that position is about $152,000. That includes the squad and, all the equipment. Tax levy would be affected by about $65,879. And then also recommended was those part-time recycling positions. Though this is no effect to the budget because the recycling budget is a standalone budget and it's based on the revenues. So if it's not in the expenses, then it would just go straight to excess fund balance to just kind of build that fund. So no dollar change with that. So you can see that the total budget had an increase of $222,879. Tax levy effect is $65,879. Any questions?
Yeah, what do you call it there now on the executive recommendation there for additional sheriff patrol position? Wasn't that going to be like a 75% grant?
There is a grant that's part of that, an additional 30,000. But and that's part of it too, where tax levy would be affected by 65,000. Part of it will be fund balance in the SISOP for the equipment, and then there is the 30,000 that's for the grant increase that we're expecting. And we'll be showing that page in just a little bit, so it'll be a little bit clearer too. Yeah. Any other questions?
Let's go through like we do. I heard from you board members that you want to stay to the standard drafts that we do. So I do want to respect that, and I want to go through this. So as we do every year, we break our budget down just at a glance where the dollars are spent. You look at this published budget would have a total expenditures of $67,174,418. As I talked about last month, you just look at the top four. These are the big four that drive the county. Almost 70% of the expenditures will be in four areas: sheriff, health and human services, highway, waste to energy. Recycling is down in the special revenue funds now. So these are very big things that we do. Protect people here. We protect children and families here. We pave roads, we fix things, and here we make sure that we don't have an abundance of garbage laying around in our county. So that's very little change from last month if you want to slide down. I mentioned this when we started out. I want this, the board and the public to be very aware how critical now sales tax is to this county. Over $5 million. We started out at $874,000. I think it was $874,491 in 1986. This has really grown. It grows at an average rate of 8% a year. That 8% is 3.3% higher than the increase in equalized valuation of the entire state of Wisconsin from 1947 till to date. So our sales tax is outpacing, so expenditures is outpacing home prices. Think of that.
What drives that tax increase?
People are spending more.
By coming in here or visiting or what? We don't know.
No. They're spending more. So graph number 2, our budget changes since last week. Did you already cover that?
Yep, we already covered that.
So let's go excess fund balance and where we're going to do that. We talked about this. I want to point this out. Look, if we would not be looking at putting extra money in our health insurance fund at $500,000, if we were sitting here today talking about having $400,000 more of additional costs of out-of-home placement or MEF costs, we wouldn't be doing that. We would be making serious changes to our health insurance fund. So there's a positive thing. Jody talked about setting this money aside. However, the executive committee did put a caveat on this, or upgrades to this auditorium, which we're going to talk about just as I wrap up the budget. So with that, we're putting $284,000 towards the 2021 budget from fund balance. We're looking at $1.1 million for surface transportation projects, which is, really we're looking at drawing down $1.1 million, so state and federal money, very important. Setting aside money for COVID and setting aside money for projected shortfalls. Jody has talked about the changes here. So this draws our fund balance down to 33%. Very interesting. Dunn County, we're talking to their county administrator today. Their budget is very similar to ours. They, other than They're drawing down some fund balance, but they've had a very poor year in their self-insurance fund and have made huge changes. We've had a good year. So these are all positive things. Jody, you said anything you want to cover here?
Nope.
Okay. Let's go to look at our summary tax allocation. This is where we bring the entire world of our budget for the county together. We start out with where we're going to spend money, operations and maintenance. You see that this is the general and all the special revenue funds and how this is going to affect the tax levy, because this boils down to what we're going to spend on the levy. We have debt service at 2.9 million. Highway expenditures pertaining to the levy of 4.1. Contingency of 863,000 and 750,000 in our capital improvement fund for 33,537,578 that affects the levy. Then we offset that with revenues to reduce the levy by $11 million. And you can see county sales tax at 3.7 plus over $1 million of fund balance in our sales tax fund. 25,000 in jail assessment fees, 335,000 in out of county revenue, and then general fund balance applied of 284, which I just showed you on the previous screen. Means we're offsetting $11.9 million against the 33 million. Means we're looking at a base levy of 21,629,444. But then we have Act 150 and Act 420 expenditures. This 538,883 is for county library systems. So that's what we owe them under Act 150, and then 31,634 for people who live in our county but go outside of our county to check out a book. We reimburse them at 80% for that. So you're looking at a projected levy of 22,199,961 if you include the request to move the personnel around in the sheriff's department, or 22,134,082. So we're either looking at a 0.81% increase in the levy or a 1.11% increase in the levy. Jody calculates net new construction because this is the levy limits constraint that we're under. We're still 429,113 under the levy limit cap, which is very admirable for a county of our size to still be under the levy limit. We're looking at increased valuation of about 4.6%, up to $4.6 million. That's probably a good thing if you're the Steinbrenner family, because now Barron County is worth more than the Yankees. It's probably a good thing. The Yankees are worth $4.2 million. All of Barron County is worth 4.6, so we don't have to worry about the Steinbrenners want to swap county for the Yankees. Good thing. Okay. Debt service, we're looking at a 0.56 mill rate, 0.18 mill rate for library, 4.14 mill rate for operations, a 4.87 mill rate, down from 512 a few years ago. According to the Green Book, produced by Wisconsin Counties Association, Barron County still is in the lowest 50th percentile of mill rate. So I've been here 20 years. This is my 21st budget. Barron County has never been, as far as my memory will serve me, we've never been higher than 52nd, and we've always typically been lower than 50th percentile, meaning if you leave Barron County over 50% of the time, your tax rate's going to go up. Your mill rate, your total taxation is going to go up. SmartAsset.com says that we rank exactly, we're in the top 5 counties in the state for lowest overall tax rate. It's pretty impressive. Smart Asset is a non-government entity. They rate taxation and across every state. Yes, Wisconsin's one of the highest, but Barron County is one of the lowest. Executive committee is looking at a $30 charge per approved parcel, 564, 570, so we can start transitioning to manned sites. So that is our all-in levy that affects the property tax, all-in budget that affects the property tax levy. So with that, we'll talk about personnel changes, and those are unchanged from last month, with the personnel for the one patrol FTE and the grant funding Jody talked about at 30,000. The 88,701 is for the part-time people out in recycling, but that would be covered by the $30 per parcel assessment and start transitioning to manned sites, which the city of Chetek. We're just waiting to have a fence built in the city of Chetek, and we'll start there with manned sites. So, are there questions on anything I presented so far? So very little change from September again. We'll look at the contingency fund, and then we're essentially done. So, is there any change in this okay, so no change in this from September. So, we're looking at contingency, employee payouts and terminations, a 1.5% pay raise, 100,000 for possible plan changes as people make changes, and then 5,000 for our district attorney, looking at additional expert witness fees. So 863,000 in the contingency fund, which I told you about over on our summary tax allocation. So as Jody said, this budget stayed effective, for all facts and circumstances is as it is until the public hearing, and then any changes would be made here at the board. Jody has drafted 2 financing resolutions, one with no sheriff's position in it and one with some sheriff's positions in, at the request of Supervisor Taxtall and some of you calling me and talking to Louis and others. So there'll be 2 different resolutions, whichever one the county board passes, then becomes the law of the land for 2021. So unless there's any questions, that's all that I have on the budget, other than I do want to show you the schematics for this room, and I just want to show the U's. Let's start with the U.
Okay.
So we're looking at upgrades to this auditorium. Be the first really major upgrades that have been done. So this is, I hope you can all see that, but this is what this would look like, except after some discussions with Mr. Rinzig, Chairman Oki, and Steve Olson and others, this, you're looking at 2 U's with, however, you'll notice here, I'll show you, these walls up here stay here, but after consideration, these walls would come out, the stage would come out, which would mean that these U's could get longer, or we could put in a third so that we can spread out a bit more. There's also another thing missing from this picture, and that would be to put, it's been suggested that we do something at an angle, like where Supervisor Heller is, on the end of these here, so that, say, Louis and John, and then myself and Deanne can sit, so we can sit here at an angle. So that's being worked on. This is not the recommended one. Would you show the one that they wanted us to go with? But as I talked to several of you.
Well, here's another
view.
From that.
Yep, what this would look like.
But then you wanted to
That stadium view. This is the one that, nope, let's go to the next one. This is what, let's go to the next one. Let me just do that. We'll get there. Just be patient. Rotate that. All right, this is what they suggested, and we don't want to go back to these days. This would be like it being in school, and I got a lot of negative feedback from everyone. Nobody liked this. So this is really off the table. So let's go back to the U designs. So this is what we're looking at, making some improvements here. Each board supervisor, would essentially have a place to sit. We would do electronically. We would put in microphones and speakers so that when you wanted to speak, you push a button, you talk, all the other supervisors would hear it. Take your finger off the button, you could hear what anybody says. So everybody had access. If you do have hearing aids, we would provide you with a plug-in and you could put headphones on. That's what we need to do. And I think we haven't made any major improvements to this room since 1964, according to Steve Olson. We've only put in carpet and ceiling tile and reupholstered those chairs in 56 years.
The seating capacity, is it the same?
Yes, this gets about 34. But if or we do another smaller U way back there, what I would envision is the county board at a county board meeting staying in this general location. And then if we were to have a training, there was a smaller U back there. Now they're working all those details. Yeah, it's a little tight.
But audience
Stays the same. Yeah, the stadium seating would stay here.
How are you going to be setting up the projecting screens?
That's great. We would just take this here and pivot it out so that you would just, if you were sitting here, for example, if Roberta was sitting where she was at in this U right here, you could just look over here because this would just be at an angle. We'd probably take out this one here, Jim, or move it back, but if this, based on this design, we'd only need the 2 screens. Not that we wouldn't have 3. I think you had a question.
Have you looked at all about maybe taking a row or 2 out so that you don't have that center U where people have their backs to people?
They didn't like that. There's something under the floor here that they didn't like.
To me, it's part of the problem.
Well, that would be up to the property committee. If they don't like that, we can ask that question, but they'll need to answer that. Yes, sure.
Would there be new seats in the auditorium? Those are getting rather short. We've grown a lot.
I'll ask. I don't know. That's a good question. I don't know, but I'll ask.
What's that?
New auditoriums.
Well, they look like new seats.
I can ask.
Are you asking for recliners too?
All right, you want them a bit larger? You want massage chairs? Okay.
No, but taller.
Taller, okay.
And taller. You can sit down and just go.
And the same black chairs or?
Well,
Like
these chairs will go. No, that's a good point, John. These chairs would go. These would be new chairs of a different style. These have been here a long time.
Long time.
And typically like this, we usually give them to a school or to a nonprofit or somebody will get them. So yeah, give those away. Other questions? Jerry?
Yeah, when Alex was here earlier, it was very difficult to see the 2 side screens. You know, it just seemed like you could see it, but I mean, it was hard to pick out the numbers on it. And I just was gonna mention that for future, because anyone sitting up here that might wanna see it, we should have a screen for them.
Right, well, we might move those above you because they're projecting right now. Or if you're a county board member, like I said, we would move these out so that when you're sitting anywhere here, you can see them because you're gonna be sitting anywhere in a U, you can see those. Or if we put in docking stations at your desk, you could pick, flip up your laptop and see it there. So, but that's what we're gonna get if we have fixed locations instead of stuff rolling around. We can't ever put anything in here because as soon as you do, somebody trips on it or we move it for another meeting. Here, it's gonna be permanent. Somebody wants to use this, they're gonna say, this is our configuration. We're gonna say, this is our configuration. This is what it looks like. You can use it. So again, property committee is gonna weigh in on this on November 9th with some more details. But that's what's built into the budget. Property committee approved $35,000 in routes to recovery money. We are looking at, Mark Kennedy is looking at, according to the rules for that, as long as we purchase the product and pay for it and get it delivered here we pay for it by November 6th. We have it delivered before the end of the year. We're good to go. So some of these costs, not for the physical part of this, but for the electronics can be paid for in routes to recovery money. That's a very good thing. I'm excited about that. So any more questions for me?
I'm thinking about Pete's too. Because I'm short, so I sit back here, and are these gonna be in between for the next ones in the back row or not? Maybe that center should have lower backs of their seat. I don't know. I'm just thinking.
We can put you where you want. We can put you in there.
I know, I need more of a little catch-all.
I'm just kidding. We'll ask that question on the chairs. Maybe some not high back. Okay, that's good.
On the back, when you look for the stage, they look lower. To be honest, it's imaginary.
Louis, that's all that I have.
Okay, we'll go on to number 19, a report from you, Chippewa Barren Housing Authority.
I put into your packet some information from the Chippewa County Housing Authority. We're a partner with them. That's just for informational only. And the second item there pertaining to poll workers, we don't need to talk about that. Deanne's got that covered, and I don't have any appointments.
Any claims, petitions, or correspondence, John? Suggestions for future items will be the budget hearing on November 2nd at 6 p.m.
Remember, folks, please put it on your calendars. We start at 6 p.m. with the budget hearing. I don't know if Sean will be here for sure, but he was leaning towards he's going to try to be here to talk to you. So there'll be some important things on both levels there.
will we have any action on the agenda items on
Request for proposals, yes.
on the request, for proposals?
Well, if you can get it done that fast between the 26th and the 2nd.
We're hoping that we have one a second. We might have to have that meeting in November 10th. But we're gonna get it done as soon as we can. Anything else? Not at 8:35, we'll adjourn by unanimous consent. Thanks, everybody.